to 98% of patients with eating disorders have a co-occurring GI disorder. Let that sink in a little bit. If you don't experience symptom relief, any type of help from following this diet within 2 to 4 weeks, stop the diet. It is not an effective route for us to take. Some of the biggest myths that I'm seeing is that you have to stay on a low FODMAP diet forever. Are you chewing your food enough? Digestion begins in our mouth. While IBS is a chronic condition, it's not necessarily like going to be cured. It is a lifelong condition that you have to learn to manage.
Hey friends, before we dive in, I just wanted to say thank you for tuning in. It means more than you know. When I started this podcast, I wasn't sure if anyone would care about gut health the way I did. But every message, every listen, every share, it's been so encouraging. This year, I'd love to grow this podcast into something even bigger. Something that helps thousands of people who feel stuck, frustrated, and unheard when it comes to their digestion. If this show has helped you in any way, I'd be so grateful if you hit follow or subscribe. It only takes 2 seconds, but it really helps get these conversations into the hands of people who need them most. Thank you, and let's hop into the episode.
Hello, everyone. Welcome to another super exciting episode of the BioBelly Show, where we love to talk about how we can lead healthier lives by prioritizing care for our gut. This week's guest is Samina Qureshi, a registered dietitian and the founder of Wholesome Start, where she helps people heal from IBS and gut issues without restriction, shame, or fear. Known on Instagram as @inclusive.ibs.dietitian, Samina specializes in non-diet nutrition, culturally inclusive care, and sustainable approaches to digestive wellness. With a background in both IBS nutrition and eating disorder support, Samina challenges mainstream diet culture and helps clients rebuild a peaceful relationship with food while managing bloating, pain, and irregular bowels. Her philosophy is simple. You don't need to cut out entire food groups or fear your cultural dishes to feel better. You just need personalized, compassionate guidance. Samina, thank you so much for being here today.
Oh, thank you so much. That was such a nice introduction.
Absolutely. Absolutely. And well deserved as well. Samina, to start off, we'd love to, get some basic definitions clear. If you can share with us, what is IBS really, and why is it so often misunderstood or misdiagnosed?
Yeah, so IBS stands for irritable bowel syndrome. It is a condition under the category of disorder of gut brain interaction, right? Which means that there is some type of miscommunication between the gut and the brain causing hypersensitivity, which includes pain, abdominal pain, and altered bowel habits, right? So you may experience abdominal pain with constipation, abdominal pain with diarrhea, abdominal pain with both. And it can also accompany other symptoms like excessive gas, bloating, abdominal discomfort, distension, and of course, that belly pain.
Got you. Got you. And of course, you have a lot of clients that come to you saying that I have certain symptoms, and it is always a challenge trying to figure out exactly what issue or what type of IBS it is. Would you be able to share with us what are the common misconceptions about IBS?
Yes, absolutely. So I think if you go back to the definition, abdominal pain has to be present in order to be diagnosed with IBS. IBS is not just I have had chronic constipation for my whole life. I have been diarrheaing for the past 3 months, or I'm always bloated. It has to accompany that abdominal pain. And what makes diagnosing IBS really difficult is that there's no test to be like, hey, take my blood or my saliva or my stool and tell me whether or not I have IBS. It is a diagnosis of it's a clinical diagnosis where your doctor is going to talk to you and better understand the length of time you've been experiencing the symptoms and how they've been showing up. And then after ruling out some other potential conditions like ulcerative colitis, Crohn's disease, celiac disease, they will then assess whether or not you have and diagnose you with IBS. And sometimes I think patients report on average it taking up to 6 or 7 years to be diagnosed with IBS. So yeah, I have patients that
Wow.
come to me thinking they have IBS. And first and foremost, I believe you because I'm not the one that's coming seeking out help for the symptoms that they're experiencing. So I'm not going to brush anyone away and say, like, no, 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 it's all in your head because that's sometimes it is all in our head with IBS.
Right.
right?
Absolutely.
And as I said, IBS is a disorder of gut-brain interaction. So how our mental health is, the emotional or mental state that we are in can absolutely impact our GI symptoms.
Gotcha. As I'm learning more and more about IBS and just the cases, like the different case studies, it's interesting because one thing I like doing to get a more of a inside view of what IBS, how IBS affects our lives, is I have on my phone, I have Reddit. And so I have like, I'm in these IBS groups and I can see like all these different messages of these people saying IBS is ruining my life, been on the toilet for 6 hours, and just like understanding like their like personal take on how it's affecting their life. I have seen stress come up again and again and again. And it is definitely something that we underestimate, like the effect of our mental health. You wouldn't think, like you would think, like I personally thought they're just two different zones, but they are directly linked. To your point with the gut brain axis, Samina, there are so many different clients that come to you, and of course, when you're trying to diagnose each of them, as you said, the preliminary tests are of course to rule out the major irritable bowel diseases like the ulcerative colitis, the Crohn's, and the celiac. But then afterwards, once you do realize that that's probably not the case, how is it that you can personalize gut care for each specific person, given that every gut is somehow unique, correct?
Yeah, absolutely. And I partner with GI doctors, right? So physicians are going to be the one that are actually diagnosing you with the condition. So while I
Right.
can believe your symptoms, we do need to partner with a doctor, an MD or DO, to get that diagnosis and really order the tests and understand what's going on with your medical health, like internally. And so, when it comes to personalized nutrition care for IBS, each person is unique. And so their treatment plan should be as well. And so the first thing I do with all of my patients is have them complete a intake questionnaire where I learn more about their relationship with food. Have you ever struggled with disordered eating, body image, eating disorders? Do you fear eating out? Are you scared to eat because of the symptoms that you experience, right? And so in addition to that, I also have information about their lifestyle. What's going on day to day? Are you in medical school? Are you in law school? Are you graduating high school? Are you about to get married and you're so stressed with wedding planning? So I'm trying to look at like the amount of stress in your
Hmm.
life
Yeah.
and really assess like what's going on. In addition to that, I want to know about your lifestyle. So what is your daily routine? Are you a parent of two and you barely have time to take a sip of your hot coffee in the morning before it's time to go and drop the kids to school, right? So that customization comes into play during that initial nutrition assessment where I am asking these kind of private questions, right? And I want to know about your relationships. I want to know about who you're living with. I want to know about who is purchasing the food and who is making the food in your house.
Okay.
Because with different cultures, oftentimes there's multi generational households, right? Where grandma or mom are the only ones allowed in the kitchen. If you step foot in the kitchen, you're gonna get hit with a wooden spoon. And so,
Right.
does that patient of mine have an opportunity to even have a say over what they're eating?
Oh,
Right? So, a lot of in depth, open ended questions during my nutrition assessment to really then come up with the next step in your care plan. And I had brought up eating disorders. So, the reason I bring that up is because up to 98% of patients with eating disorders have a co occurring GI disorder. So, let that sink in a little bit.
sorry. Could you yeah, say that in other words? My bad. Right.
Absolutely. So 98% of people with an eating disorder, binge
Right.
eating disorder, bulimia, anorexia, ARFID, etc.,
Hmm.
experience a GI disorder as well, right? And so if that says that, hey, you have something going on with your ability to nourish your body with this eating disorder and you are experiencing GI issues, it's really important to address that piece. And so that's where I come in and I also work with therapists to help guide the nutrition recommendations in a way that will not trigger then those eating disorder thoughts and behaviors. So for example, the main nutrition protocol or therapy for IBS is something known as the FODMAP diet, right? FODMAPs are fermentable carbohydrates that can cause excess abdominal pain, gas, bloating, and then either the diarrhea or constipation, whichever way you end up leaning with your IBS. And so that FODMAP diet the initial phase is about 2 to 4 weeks where we eliminate all of the FODMAP containing foods, for you to ultimately experience some type of symptom relief. Reduced bloating, reduced abdominal pain, better bowel movements, etc. If what we run into though, because oftentimes GI doctors will just hand out like a list of low FODMAP foods to avoid or include, etc., and say like this is going to help you, go do it. Run with it. They don't necessarily always refer to a dietitian. What I see happening in my practice is people being on the elimination phase of the low FODMAP diet for years. I'm talking like 2, 3, 6+ years and still not experiencing symptom relief. And with this diet, if you don't experience symptom relief, any type of help from following this diet within 2 to 4 weeks, stop the diet. It is not an effective route for us to take. Restricting more food is not providing the nourishment for your microbiome, the little bacteria and microorganisms living in there, to thrive. We're reducing the total carbohydrate load, which effectively reduces the total fiber load. So it's not recommended to be a long-term solution. It is for you to gain relief and work with a dietitian to strategically reintroduce each FODMAP to better understand your personal tolerance to those foods and intolerances, and then continue to expand your diet and make it as liberalized as possible.
Got it.
And I wanted to add one thing. And so, with that being said, for my population that struggles with an eating disorder or an undiagnosed eating disorder or just their relationship with food and body image, the low FODMAP diet is contraindicated, meaning that it is not recommended because it can further exacerbate their eating disorder behaviors. And then we know that eating disorders are complex mental and physical health conditions. If it's impacting your mental health, it's absolutely impacting your GI health. So, we have to roll things back a little bit and work on healing that relationship with food in order to see how your GI system functions at baseline with adequate and consistent nourishment, and then go from there to see what symptoms still are presenting themselves and customize the recommendations from there.
Gotcha. And as a dietitian, how is it that you're able to gauge how long a person should be on that FODMAPs diet? What are the specific things you are checking for to make sure, okay, this is most likely a FODMAPs issue, and so from here we can slowly start, eliminating these foods, and then slowly start building the tolerance for these types of foods versus, okay, this is not a FODMAPs issue. It could be either, a food poisoning or,
Mhm.
anti or histamine intolerance,
Yeah.
etc.
Yeah, absolutely. So, first and foremost, before I even recommend the low FODMAP diet, we do a food recall in that initial assessment. I'm like, okay, tell me what a normal day looks like for you. What are you eating for breakfast, lunch, dinner, whatever foods you eat throughout the day? And if I'm not hearing like high FODMAP food offenders, for example, like every day I'm eating an apple for breakfast and then I'm following it up with a Brussels sprout salad and then I'm having cauliflower rice bowl and I'm having all of these foods like with onion and garlic that are known FODMAP triggers,
Right.
and they're like, "Oh, I eat oatmeal in the morning with lactose-free milk, and then I eat a banana and peanut butter, and then I have grilled chicken with some spinach salad, and then a rice bowl with some chicken and tomatoes." And I'm like, "Okay, that sounds fine." The first diet is where I would say, "Okay, let's try to provide some low FODMAP swaps and see how that makes you feel." The second diet, I would say, "You know what? Let's take a step back. Let's see what it's like to help you eat a little bit more consistently throughout the day, add in more variety of fruits and vegetables to meet your fiber needs, and then see how your symptoms improve." And so, with my practice, I'm seeing people in my 12-week IBS Food Freedom program. And so, what that offers is 6 sessions over a 3-month period. So, we're meeting every other week to really understand their progress and what symptoms are improving and which ones are getting worse and what they're changing. And so, when you come to me, I'm not going to give you a list of things to do and you run with it. It's going to be like 1 or 2 things you're working on until our next session to gauge how you're feeling with those changes and whether or not they're helping. And then we can then, during that follow up session, go to the next step and say, okay, this is where we're at today. This is where your symptoms are at. And this is what we're going to try now.
Got it. And one thing that, Samina, you talk a lot about is how you are a non-diet IBS dietitian. Just by seeing how, you walk through patients and patients like towards their recovery, I can see how you are, definitely top of the cream in terms of a dietitian, because you really look at a client holistically,
Hmm.
in terms of like, and as you said, the relationship with food? Are you even the one in the kitchen? Like these questions, they would not even come in my mind. However, as you explain them to me, I can see how certain things can cause stress, certain things can cause a food intolerance or a fear. What does it mean when you say non-diet IBS dietitian? And what are some nutrition myths that drive you crazy?
Oh my gosh, I love this question. So, to me, a non diet IBS dietitian means that I am going to recommend the least restrictive nutrition recommendation for you to avoid food fears, to help you overcome and expand your diet, and help you navigate this in a way that feels good. Right. And so, some of the biggest myths that I'm seeing is that you have to stay on the low FODMAP diet forever, which we know is not true. That a low FODMAP diet is just there for that 2 to 4 week period for you to experience symptom relief, and then you work to expand your diet and understand your personal triggers, and hopefully you're able to expand from there. Another really big myth is that the low FODMAP diet is gluten-free and dairy-free,
Oh, okay.
right? While gluten-containing foods have wheat in them,
Hmm.
with FODMAPs, they are fermentable carbohydrates. So it's not necessarily the gluten, the wheat protein, that is an issue. It is the wheat carbohydrate. It is the fructan in there that is
Hmm.
the issue. So there are some gluten-containing foods or wheat products that happen to be tolerable for those on the low FODMAP diet. For example, sourdough bread. The fermentation process helps to break down the fructans in there and make it a little bit more tolerable for those with IBS on the low FODMAP diet. Same goes with dairy, right? It's not that we have to go, okay, I'm going to go completely vegan and I'm never going to touch dairy or any animal product ever again. It is how do we find lower lactose or no lactose dairy products that still provide you with great quality nutrition because we're getting calcium, vitamin D, excellent source of protein, and so many other vitamins and minerals. So you can opt for lactose-free varieties. So the brands that add the lactase enzyme into the dairy product to help make it easier to digest. Or there are really great regular dairy products out there that are naturally lactose free. So if we're looking at like mozzarella cheese, cheddar cheese, some of the harder cheeses, kefir, if you get
Hmm.
like 99% lactose free, but if you want for sure 100%, you can buy the lactose free varieties. So, yeah, there's a lot of options out there to help, again, take the fear away from eating certain foods and make a well informed decision about what you want to eat and how to fuel your body without feeling like you can't eat anything.
Right. And so many people, right? And I think you mentioned this earlier about the cultural aspect with, multi generations in the same household, and there being some certain way of things, like a certain number of specific people in the kitchen and everyone else not having access to what's going on
Yeah.
and what's going to be served on the table. A lot of people actually they do feel with these IBS issues, they have to give up their cultural foods to heal their gut. What's your take on that? And how do you help people eat without that form of fear?
Yeah, yeah. So I am South Asian, and so we eat a lot of like salons is what we call them, like stew-based
Yeah.
foods, right? With onion and garlic sautéed, then tomato, then ginger, and then you add this aromatic spices and you add whatever meat or vegetable you want to cook with it, and it becomes this nice big stew that's delicious. You eat with rice and dal. Right? The first step I take is learning about each cultural food, right? Because I'm South Asian and I'm gonna take a guess. Are you South Asian?
Yes, yes. I was born in India actually,
Where yeah, so what part of India is your family from?
from Rajasthan. So actually
Okay.
northern India.
Yeah,
Yes.
yeah, yeah, and so that is so different from Hyderabad, right?
Yes, yes. Very yes.
Where my family is from, and so the cuisine is gonna be different, whether you're vegetarian or meat eating is gonna be different. There's gonna be so many different nuances, and just because we're both brown and look like we have the same color hair and skin color does not mean that our family cooks the same or has the same cultural traditions, etc., right? And so I'm there to listen and learn to my patient to learn what does eating from your cultural cuisine look like for you, or do you even eat that at home? Does your family, like, cook that at home, or are you eating, like, other foods and that's what you guys prefer, and that's awesome. Learning what it is so I can better understand what ingredients are going into it, how it's prepared, and then offering swaps. So if you're saying, "Okay, my family 100%, anything they cook is gonna be sautéed in onion and garlic first," there's workarounds that we can
Mm,
implement, right? You can either buy your own onion and garlic infused oil,
Hmm.
that has the same taste and flavor without the FODMAP load. Because
Oh,
FODMAPs are water soluble, they do
right.
not leach into oil. But whereas if you cooked onion and garlic in a soup, the FODMAPs would then leach into that liquid and it would be a high FODMAP food for you. So going back, we can opt for onion and garlic infused oil, or if that's the main cooking process for your family, you can ask whoever's cooking or if you're cooking to scoop out the onion and garlic after you've sautéed them, leave the oil, right? And then
Right.
continue to cook the rest of the dish so we have that aromatic flavor and depth
Right.
that you want. Whoever wants to have the sautéed onion and garlic in their dish, just add it on the top. So there's workarounds, right? And
Hmm.
so the first step is really understanding where that patient is coming from and what their cultural cuisine is like.
And speaking about cultural cuisines, there is something that I've heard a lot, but I haven't seen scientific literature backing it. I wanted to ask you. Some people say that depending on where you are, like where you were born, which region you're from, you are naturally predisposed to digest certain foods better than others. So for example, if me being born in India, I might be digesting like carbs like roti or certain subjis
Mhm.
or dals better versus a person in Italy might be predisposed to digest better carbs like pasta and spaghetti and pizza. I was wondering if you can tell me a little bit about that. It's something that's been lingering in my head, and I think you just sparked it by talking about the cultural aspect.
I think that's a really great question, and I don't have an answer for you.
All good.
I would also have to go do a deep dive into the research because that's very interesting.
Right? And because I used to think a lot about how specifically like pizza and pasta. At first, I used to think that maybe the reason for why when Americans in America eat pasta and pizza, usually there are associated symptoms of bloating and either gas, weight gain. But in Italy, some people primarily eat pizza and pasta, and for them it's they're healthy, they don't have those associated symptoms. At first I thought it's a cultural thing, but then when I looked deeper into it, and you probably know way better than me, it also is the quality of the food itself, right?
Yeah, there's that factor, but I also wanna look at the lifestyle factor. In
Right.
America, we are a very, very busy, rush, like, "Okay, I have 10 minutes to eat this lunch, I'm gonna scarf it down really quickly without chewing, and then I'm gonna go sit at my desk for another 4 hours to finish out my workday." In Italy, their lifestyle is take a leisurely 1 to 2 hours lunch, chew your food, enjoy, have conversation, connect with your meal, and then walk a mile to get back to wherever you came from. And you
That's the
step
life.
and right? So, like, you it's a little bit more relaxed, and we're coming back to that gut-brain connection.
Right.
Not only the stress aspect of rushing to eat through your food and get to the next meeting, there's also the ability to just sit down and mindfully eat. Are you chewing your food enough?
Mm.
Digestion begins in our mouth. Our saliva has enzymes in it known as salivary amylase that help to break down carbohydrates. If we are taking 2 bites of the pizza, chomp, chomp, swallow, the saliva does not have a chance to meet all of those carbohydrates and begin the digestive process. Could that have an impact on it making its way down the digestive system and you experiencing excess gas, bloating, or stomach pain? Probably.
Probably.
There's so many factors, and I hate to vilify the food systems here because
Right.
that doesn't do anything.
Yeah, true that.
Y If we live in America, we live in America. You can choose to buy organic or conventional, and that's a personal preference, whatever. But if we can then say, "Okay, I know that they are able to possibly work towards mindful eating more because they have more time. How can you make that more of a priority here?"
Absolutely. Absolutely. And, speaking from what you were mentioning about how specifically in America there is this hustle and bustle culture, some people, when they do have issues, they do tend to rely more heavily on quick fixes. So
Yeah.
for example, supplements, right? I was wondering if you can tell us how you approach supplements with your clients, and especially when so many people are overwhelmed by options of supplements or just chasing quick fixes.
Yeah. So again, during that nutrition assessment, I have people complete the intake form, which I want them to write out how many supplements, what are they? What are you taking them for? Was it prescribed by a doctor or where did you learn about it? Then I want to know, yeah, what they're taking. And from there we talk about whether or not they're necessary. Because when it comes to supplements, less is more, and they need to be used as a supplement to your daily nourishment plan. They are not there to completely say that this is my insurance, it's gonna be fine, like, I'm taking the supplement, I know my gut's gonna be okay, because that's not how it works. Oftentimes, I have people coming in with pages of supplements that they are taking. They will even I'm a virtual dietitian, so I see everyone virtually. They can go to their kitchen cupboard and open it up and be like, "This is the hundreds of pills I'm taking a day." And then I have to break the news to them that I would like them to stop taking them if they're not doctor prescribed,
Right.
because we cannot tell what your gut is doing or how it is functioning at baseline if it is being clouded by all these concoctions of supplements. And so, if we need a supplement, I will recommend them based off of the evidence that I've seen to help specific symptoms. There's never a moment in time where you need to take a probiotic long term, just willy nilly for better gut health, right? You need to then look and see which strain at which dose for which amount of
Right.
time is going to for you to take it is going to help that specific symptom that you're trying to find relief from. C. diff is going to be different probiotics than just general constipation or food poisoning. So, yeah, there's a lot more that goes into supplement recommendations than but this person online said their bloating went away after taking this up. If it
Right. And
sounds too good to be true, it likely is.
yeah, yeah. It's funny because the more I learn about this, the more that's affirmed that the easier it sounds, the more likely it's probably a fad. It's interesting too. I wanted to share with you, like, there's a lot of like these self-acclaimed healthy people online that I actually am very interested in. Like, I've watched them. I find myself looking at what they eat and kind of jotting it down. But for example, people like Brian Johnson. He has like this blueprint and he's all about anti-aging and he's very healthy. And he
Mhm,
takes, to your point, he takes like a cabinet full of supplements every day.
mhm.
So it's just funny because like to your point, like how important is it to have like hyper optimization of health with certain supplements versus having a more holistic approach with just having the right foods in your daily diet?
Yeah, and another thing I will say about supplements is that they are not tightly regulated. It's harder for a food product to get out in the grocery store than it is for a supplement to be on the shelves at the supermarket or pharmacy.
Mm,
And no one's stopping them from making a pill full of sand.
wow, that's not okay. Right.
So if they're not regulated, you could be taking not that that is what's
Yeah,
happening.
right.
Right,
Yeah.
like, these
Yeah.
companies are making
Yeah.
products that they want to
Mhm.
help people, so that's not what's happening, but
Absolutely.
with supplements, what I'm trying to say is you unless they have been third party tested for efficacy, quality, and, like, testing the claims that what is in that product is at that level of nutrient or whatever, you really don't know. And the thing is, like, okay, you're taking a vitamin, right? We're just talking standard multivitamin.
Mhm.
Great. You wanna help fill in the gaps to your nutrition? No big deal. But if you're saying, "Okay, I am going to eat pizza every single day because that's my safe food, and then I'm just gonna fill in the gaps with this multivitamin," what are you missing out on? Well, you may be getting the vitamins and minerals from that vitamin, you're missing the fiber, you're missing the
Right.
hydration, you're missing the antioxidants that are really, really helpful for reducing inflammation, and so many other phytonutrients that are health supportive. So that's why when it comes to supplements, if people are taking them and they're like, "No, I know I feel very low energy. I want to support my body. I want to take this B12 to increase my energy." Then we look back and we say, "What foods are high in B12? Can we prioritize a food first approach so that you get the benefits of taste, satisfaction, flavor, and nutrients that support your body and is probably cheaper than buying the same supplement every single month?"
Right. Absolutely.
So, yeah,
Uh,
there I do take a food first approach, and I'm also not scared of recommending supplements. It just has to be the right one for you. And there absolutely are supplements that help with IBS, specifically, like, pain management. So,
okay.
menthol has been shown to be effective at reducing, like, abdominal spasms and pain for those with IBS.
And specifically menthol, is that like, of course it does produce that pain relieving effect, but is it something that does play a role in the healing aspect as well and the gut healing aspect? Or
No, like, if you're
I got
talking
you.
about injury to the gut lining
Oh, okay.
and things like that, that would be L-glutamine.
L-glutamine. Got you. Got you. I'm taking my notes. It's good to know, right? But yeah, like I think my follow-up question was you have reached out to so many clients and so you have a wealth of information of just these all these different case studies of IBS. In your view, how much of IBS is driven by food versus lifestyle versus stress versus trauma?
It's all related, right? So just because we put a Band-Aid and we eat the low FODMAP diet does not mean that you are not going to have an IBS flare. If you then are in a car accident and your stress levels are really high while you're recovering from that car accident, you may be experiencing heightened GI symptoms even though you're eating low FODMAP. Or I think I can't remember the exact percentage, but people who don't get enough sleep experience heightened IBS symptoms. So if you're like, I have low stress, I'm eating well, I'm exercising, I'm doing hydration, I'm taking my peppermint supplement, et cetera, but you're getting 1 hour of sleep because you just had a baby and they're waking up every 30 minutes and life is pretty hard, it's likely for you to experience an IBS flare. And so one thing I wanna mention is while IBS is a chronic condition, it's not necessarily, like, going to be cured. It is a lifelong condition that you have to learn to manage, and the management of IBS may look different based on different life stages that you're in. So pre having kids, you may be like, "I got this down, I'm good." As soon as you get pregnant, you're hit with, like, the hormones that make you more constipated, which causes more abdominal pain, and you're nauseous, and you're like, I'm out of luck. I have no idea what to do. So then it's just going back to the drawing board and seeing like what has worked for you in the past, what can we try now, etc., and kind of going from there.
Got you. To be honest, like what I've been hearing from you, Samina, it's almost as if it's more about it's not exactly what you do, it's how you do it. Meaning like the diet itself, like from what I've learned, and please correct me if I'm wrong. From what I learned, the diet itself, even though it does play a role, it's your lifestyle around it. So again, how mindfully you're eating, how stressed you are day to day, that somehow plays a bigger role than even just the foods you eat. Would you agree with that?
I wouldn't say like on a scale, like one's heavier than the other. I would say
Mhm.
they all have the
The
same role in a pie. Like they're the
right.
equivalent pie sizes. And all of these pies, pieces of the pie, weigh the same amount. And
Right.
if
Got you.
one of those pieces is out of balance, then you may experience heightened symptoms.
Got you. So it's just all equal factors. Got you. So in the event, right? Like someone you do feel like okay, they've had a lot of trauma and you feel like okay, these they definitely need help more towards the stress management side versus the diet side. What are the steps you do take to help them in the recovery process?
Yeah, so I will ask them to reach out to a therapist and a psychiatrist to better assess their mental health and provide them with a treatment plan. And I will coordinate care and work alongside the therapist to make
Okay.
sure that my recommendations aren't impeding their work there and that their work isn't impeding like the recommendations I'm making and that we can work together to help this person feel their best. There are other options for people who, let's say you do experience an eating disorder and the low FODMAP diet is contraindicated. You're not supposed to restrict foods, right? In any way, even if it's medically necessary for this case. And so you're like, okay, I can't really explore the nutrition side of things. Do you have any other recommendations? And they're already working with a therapist for their eating disorder and they have a psychiatrist for their co-occurring conditions where they're taking medications like anxiety, depression, etc. Then I would say, okay, have you looked into gut-directed hypnotherapy? Would you like me to connect you with a clinical hypnotherapist? You can check out roamgipsych.org
Got you.
to look for a GI psych provider in your area. And so, one thing to note with clinical hypnosis or like gut directed hypnotherapy or GI CBT is that the patients do need to be assessed by a professional, right? Like, there are these other like Mahana, Nerva, like gut directed
Mhm.
hypnotherapy apps that can be really helpful. But for some people who experience PTSD or have had trauma in their lives that they're actively still working in recovery from or in treatment for, those treatments like gut directed hypnotherapy may not be appropriate because they can send them in that trance state and they can relive that trauma. And so that's why it's important to go to a GI psych professional, whether it's like a clinical psychologist that has the additional GI psych training.
Got you. And if you don't mind me asking, Samina, I really love how you are so interconnected with the different other schools of medicine in terms of, or just different forms of healing, as you said, like the psych professional, the gastroenterologist for the preliminary testing. I feel like that is something that sets apart a good dietitian from a great dietitian. I was wondering, Is it like a specific network or something you tapped into, or was it just through your years of experience that you were able to make these relationships with these professionals across different disciplines?
Yeah, so that just comes from wanting to market my practice and make a name for myself and advocate for my patients. So if my patient is coming to me saying like, "No, my GI doctor said I have IBS." And I'm like, "Great. Have you been tested for celiac disease? Have you ruled out ulcerative colitis and Crohn's disease because they're having all these like different symptoms and I'm kind of trying to piece things together?" They're like, "No, they never told me about it." Then I will say, "Okay, call your GI doctor. This is what you need to say to get these tests so that you can advocate for yourself and we can really rule out whether or not we need to go low FODMAP. Or do we need to go strict gluten free because now you have celiac disease?" So, yes, it is from wanting to make sure that my patients get the appropriate care that they need. And I also love learning from other professionals. I have friends that are GI doctors. I have friends that are therapists, psychiatrists, pelvic floor physical therapists. I love partnering with because it is such a taboo thing to talk about.
Right. Yeah.
And I have partnered with so many specialists in the GI and eating disorder field that we actually wrote a book together.
We'd love to learn more about it if you'd love to share. Yes, please.
So I have it here.
Awesome.
Yes, it is called Comprehensive Nutrition Therapy for Co-occurring Gastrointestinal and Eating Disorders. It is written by 8 eating disorder and GI dietitians, a gastroenterologist, a GI doctor, and a clinical psychologist.
This is probably first of its kind.
It is
It's
the first of its kind, first and only multidisciplinary resource for evidence-based techniques to screen, assess, and support people that are struggling with both GI and eating disorders. And if you remember before, I had said 98% of people that struggle with eating disorders experience GI symptoms or have some type of GI disorder.
awesome. And where can we get this book?
Yeah, so it's available anywhere that you order books. You can get it on our website, edgitraining.com, Barnes& and Nobles, Amazon, all the book places.
Love it. Love it. That's definitely going to be one of my, you can say, holy grails, because I did want to share something. And I'm very grateful that I had the chance to speak with you before the podcast a little bit about what my small vision is to create a positive effect in the world, specifically for IBS sufferers. Speaking from personal experience, I have loved ones who have suffered from IBS, and that's inspired me to immerse myself into this field and hopefully create a positive effect. So right now, right, Samina, my even though I have limited knowledge, right, I'm not an expert, which means I realize the importance of having more people that are experts, of course, over multi-disciplines on my team. And for that, like my goal is to kind of build an ecosystem where people can take, let's say, a stool test, they can understand what it means with expert support, and then they can get a full healing protocol from a dietitian to a gut hypnotherapist to maybe even sleep and exercise coaches and to the pelvic floor specialist that you were referring to. Does something like that resonate with you?
Yeah, absolutely.
Awesome. Yeah. Box checked. The follow up I had for that was, what do you think is missing today in gut care that something like this could maybe solve?
Well, I have a lot of things that are missing in gut care. I think that GI doctors specifically are kind of blind to the fact that they are treating and working with patients with eating disorders because they're like, no, we just do endoscopies, colonoscopies, remove tumors. Like, we're testing, we're not seeing people with eating disorders. Oftentimes, because of this high percentage of people with eating disorders experiencing GI disorders, the first physician or healthcare provider that they often see because their GI symptoms are so severe is the GI doctor. And so, if GI doctors can take a pause and do a simple screening or assessment to assess risk for eating disorders, that would be huge. And if
Right.
they're like, yes, I see that you have this potential risk for eating disorder, we need to connect you with an eating disorder therapist and dietitian, that can be the missing piece for someone to find healing with a relationship with food and their GI symptoms without having to do like extensive invasive screenings and treatment protocols. So I may have like sidestepped your question, but that is
No,
something that
no.
definitely needs to be addressed.
Got you, got you. And for the listeners, I do believe I overlooked this and it's very important. If you could give us a simple or definition to clarify the difference between an eating disorder and a GI disorder.
Yes. So okay. An eating disorder is a complex mental and physical health condition that impacts one's ability to nourish their body in a way to sustain their life, right? So it can manifest in many different ways. People can experience maladaptive eating behaviors like chronic restriction, binge purge type of behaviors where they eat a large quantity and eliminate that in some way, whether it's vomiting or laxative abuse. It can be extreme fear of averse side effects from eating. So, this would be avoidant restrictive food intake disorder or ARFID, which is I'm scared to eat because I vomit every time I eat. I'm scared to eat because I have diarrhea, etc. There's many different eating disorders. And so, eating disorders are related to nourishing your body for sustenance, like sustaining your life and being healthy, right?
Yes.
GI disorders are complex gastrointestinal conditions that impact the way your digestive system functions or impacts the symptoms that you are experiencing related to bowel habits or eating food and digestion.
Understood.
I didn't think about that. I don't think anybody's ever asked me that question before.
Right, but you explained it to me perfectly. I could probably explain it to you back again.
Great.
I'm just kidding. Yeah, I'm very grateful for that illustration. It does clarify it in my head way more. Specifically, our goal with BioBelly, right? Along with this ecosystem, we did want to have a pre-made formulations of supplement protocols that we could have for specific people with IBS-C or IBS-D. So a big hurdle we are facing is two-parted. One is the idea of diagnosing a person with a specific subtype of IBS. So one thing is if a person, for example, and you know way bit better than me, but if they have small intestinal bacterial overgrowth, right? And we misconstrue their symptoms as IBS-C. And we're like, okay, let's give this guy a good amount of fiber. But we know that maybe an excess amount of insoluble fiber for someone with SIBO can exacerbate their symptoms. So one big hurdle we're having is and again, I say this like if it's just one person I have to heal, it's very simple. But it's like I'm trying to make a standardized method that we can use like scaled up to like at least like 500,000 to a million people where we can in some form of way, whether it's a step of a series of questions, figure out what exactly their diagnosis is, and then from there be able to, and then the second part of our hurdle is be able to formulate a supplement that would be able to have that positive effect to their unique gut. I
Yeah.
know it's a loaded question and it might be a bit too ideal, but I would love your thoughts on if it is even possible and also overall like what you think about.
I think that's really hard to like differentiate the subtypes that someone has with IBS because the subtypes that someone has can actually change over time. So you may be originally diagnosed with IBS constipation and something happens in your life and now you're IBS diarrhea subtype.
Wow. Okay.
So that's something to consider. It's not like an easy like you go this way if that, if this then that situation. It might be a little bit more complex than that. And then of course, like with SIBO, it's
That's a tough one.
very hard to diagnose as it is because the breath testing is so hit or miss.
Yeah, I've heard that.
It's 50%.
Yeah,
It's
that's
literally hit or miss.
toss of a coin. I mean,
Yeah, like breathe into this tube after having the solution and we'll see. And like you may or may not have it. And so what we do find is that doctors may just prescribe that antibiotic if they are presenting with those SIBO symptoms and see if it helps or not. I don't know about the formulation of this like diagnostic criteria and kind of how to go. I think a GI doctor would probably be able to better help you there since they're the ones who are diagnosing. But I will say that for supplements, when I'm seeing them in practice, what really frustrates me is when supplement companies combine a lot of ingredients in one supplement.
okay.
So, for example, if you're like, oh, yeah, we do want to have a peppermint capsule, but it also has ginger, it has fennel, it has all of these things that are supportive for our gut. What I'm trying to do as a dietitian is isolate whether or not something is helpful. And I
Right.
can't do that if it's a mixed product. So keep that in mind that I will recommend things more often than not if they are single ingredient versus multi-ingredient, multi-strain.
Thank you for that. And, you know, to illustrate further exactly the formulations we are envisioning, I wanted to share the formulation we have for our IBSC protocol. And from what you're saying, we definitely will consider some changes. But our formulation is a four-parted, so it has four ingredients. And again, it was after connecting with supplement formulation experts who have perused literature in the past to see the specific effects of a certain herb or a certain probiotic for a certain specific gut health issue. And so I'd like to share. So it's four parted. One is for the fiber, it's a soluble fiber. So it's partially hydrolyzed guar gum we have. So it's 5 grams of that. It's called sun fiber because the specific testing we had, as you know, they talked about sun fiber. So we're like, might as well get the good stuff, not just like general. And then the second one is tributarin, which, as you know, it helps produce butyrate, which like helps strengthen the intestinal wall, you know, to prevent that leaky gut. And then the third is a probiotic called Bacillus coagulans.
Mhm.
The brand name is Unique IS2.
Okay.
And we have 2 billion CFU of that. And then our last ingredient is called magnesium citrate. And we and a main thing we were discussing is the dosage that we should have because from literature studies we saw that 200 to 400 milligrams is usually what is recommended. However, when we did see the other brands that are well rated in their magnesium citrate product, the dosages were way higher. We're talking in the thousands. So that's why I wanted to, you know, get your overall take on that.
Okay. I love the sun fiber, although 5 milligrams kinda seems low,
Okay.
doesn't
Yeah,
it?
look, you know way better than me. You let me know, but it's just from from literature. It did say I do recall it saying 5 milligrams. I could
Okay.
share it after this, but
Yeah, yeah.
um, yeah, but yeah,
We'll have to see. I'm trying to remember
yeah, we got to see, and
what
it might be an oversight from us too. I'm gonna put a pin on that.
Okay. Look at, like, yeah, how many milligrams of sun fiber. The probiotic, that's fine if you wanna include that. The butyrate precursor is fine. The magnesium citrate, so here's the thing, we have to be careful with magnesium for patients who experience, like, chronic kidney disease and are on dialysis. Obviously, we don't want them to take this at all because it can impact their filtration and all that stuff, and I will say the laxative effect is, yeah, up to that, like, 400 mark is kinda where you start experiencing the laxative effect for people with constipation. Going into the thousands is not recommended.
We personally thought the same, and that's why we had this doses actually set at 250 milligrams.
Yeah. Yeah, and I would think that's fine. Yeah, 250 is where I regularly see my patients starting, you know? Does this
Right.
have an impact? Let's see, and if it's not enough, what would and that's why with, like, the titrating of, like, supplements, I like to have them single because then I get them to do magnesium citrate by itself so we can know the specific dose that works for them. But in a multi-strain product or like, ingredient product, while they're all excellent ingredients, and yes, they're supportive for IBS-C, it's hard for us to understand what helps an individual
That's a
if we try to piece it together.
Yeah, that's a big breakthrough because all of a sudden it's not just a supplement bottle, but it's a supplement protocol with four different ingredients that you are constantly supplementing. And then, God forbid, something does happen, you can do a like how we do a low FODMAP right
Yeah, you can exactly, you
elimination.
can
You can
eliminate.
see, yeah, as you
Yeah,
said,
and then,
yeah.
I mean, honestly, that might be a marketing ploy, like, a
Oh,
thing for y'all to be like, "You
oh,
know what? This is your opportunity to find what works for you. We sell these individually." Well, I
God,
mean,
there's
I
no
don't know
way
if
to
that's
win.
your
No, I'm
plan.
just kidding.
I
Right,
don't know if
right.
that's your plan, but, like,
Yeah, so the formulation was that it's actually a powder because we do know that magnesium citrate has a functionality of drawing blood into the intestines, and we wanted to make sure it's not like a dehydrating symptom a side effect. So we actually have a powder. I think each stick pack is probably or each serving is probably around 7 grams, and it's a powder that you have with 8 to 10 ounces of water. And that's our goal to kind of counteract any negative effects of that magnesium citrate that it could do for the dehydration aspect. But yeah, like if you think it's better, I don't know about the marketing ploy, but if you think it's better to have individual segments of each ingredient, like having one, like taking each ingredient separately, then yeah, we could definitely consider that. But it,
Yeah,
yeah,
I mean, people are taking multi-strain products because in my experience, it has the one ingredient they're looking for, and then it just has the extras.
right.
So, yeah, I think that's something to consider, like, would you want to explore that route?
Okay, got you. So in this case, it would be like if someone was like, okay, Bacillus coagulans is the thing. It's gonna save me. But then they see that there's another three things, then they're like, all right, might as well try it. Is that what you're?
Yeah.
Got you.
Might as
Got
well
you.
try it, but the dietitian will say, "Can you find them in single ingredient bottles so that we can identify which one is helping you?"
You're right. You're right. That makes sense. That makes sense. Right. I think I think the main thing I'm taking away from this is from an expert dietitian's perspective, it's best to isolate every ingredient of a supplement to be able to tell the efficacy of each. But at the same time then, Samina, do you feel that only one supplement should be taken at a time, regardless of the effects, like even a probiotic versus magnesium citrate?
Well,
No, okay.
no, no, then we would
Okay.
layer on and we'd say, "Yeah, let's try this supplement this, probiotic, and let's try 250 let's start with 250 of the magnesium citrate, and then if that did nothing, let's add on to for 500," if you're taking 2 doses.
Got you. Because and of course we can layer because there's different intended functions for each. And so if they're not fulfilling that function, then we can decide if we want to how we want to adjust the dosage.
Yeah.
Got you. Got you. That makes sense. But yeah, like it's funny, like because of course there is like a marketing aspect to it as well. And
Yeah.
we are reaching our intended audience is to my previous point, IBS cases are rising in early, like younger populations. So our intended audience is people around like 20 to 40, like in relatively younger. And so our branding and our marketing is more tailored to catch their eye. And so even our product name is plop for constipation, and it's just like these onomatopoeias just to get someone's attention, right? But I really want to make something that works, and that's something that a person like a expert like you would be like, all right, this works for me. I think it's worth trying. So I'm definitely going back on the drawing board and seeing what we can do.
Oh, no, I hope I didn't mess it all up.
Oh, no, no, no. No, 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 absolutely not. But I hope it does tell you, like, we do really care. Like, we have a lot of high regard, especially for you, like, especially with all your content and all the things you share. Yeah, we'll definitely consider like individualizing the specific raw materials of the formulation.
Yeah, no, that means a lot. Like, it's also good to speak to you because I'm getting to learn and understand the back end side of things.
Right.
And
All
I
right.
think with supplements, dietitians will call the companies to better understand the transparency, the testing that they're doing, and all of that. So, like, to have you at my fingertips is nice to better understand that whole process because
Right.
that's how we can gain more confidence in the product.
Absolutely. Yeah. Thank you. I really appreciate it. And I'm going to keep you in the loop. I'll keep you in the loop with everything we're doing just to, for entertainment, but also for us to see what
Yeah.
we can better do.
No, I'd love
Um,
that. I'd love that. This is awesome.
Thank you. I really appreciate it. And I really hope I guess the supplement aspect is a relatively easier, but that ecosystem aspect of connecting professionals, I really hope it not only makes it better in terms of being a holistic solution for patients, but also like improving dietitians' ability by, having better network to heal for a specific patient, to help a specific patient recover. Thank you, Samina. I
Yes.
I had a couple more closing questions from you. What's something you wish every person with IBS knew that would save them years of suffering or confusion?
That the low FODMAP diet is not the only nutrition intervention for you. If you find that restriction is impacting your mental health, there are ways to approach it with a gentle, non diet approach, even with nutrition. So, focusing then on, are you chewing enough? Are you maintaining adequate hydration? What is your bowel posture? Are you including the right types of fiber in your diet? And before you even add fiber, are you meeting your hydration needs? Because we don't want to add more cars to a traffic jam by like just punching in more fiber and making a more hard, solid stool. So, if you're worried that the low FODMAP diet is not right for you, there are absolutely other nutrition interventions that can help.
Received. Thank you. And just as a final note, Samina, where can people find you? I did mention your Instagram handle, but where can people find you and how can they start working with you?
Yeah, absolutely. So you can find me if you want to work with me on my website. wholesomestart.com, and I'm accepting clients in my 12-week IBS Food Freedom program where I help you learn how to nourish your body and feel your best without rigid diets, guilt, or shame.
Thank you so much for all your time, Samina. I have to say, personally, for me, this was a deeply enlightening conversation, and I had a blast. Thank you.
Thank you. It was fun for me too.